You're tuned in to the Dr. Kinney Show, and I'm your host, Dr. Erin Kinney, a naturopathic doctor and speaker dedicated to unraveling the mysteries of your body and guiding you back into balance. Let's get started. Hey everyone, welcome back to another episode of the Dr. Kinney Show. This week, it's me, and we're going to talk a little bit about low libido. What causes that? It is something that I treat so often in my practice. And if you follow me, you know I talk a lot about the importance of sexual health. It's really, really important. It is a good sign when you have a good, strong libido. It means that your hormones are in a good, healthy place. It usually means that your system is not too much in the fight-flight state. And I'm sure if you follow me, you've seen me post about how we're either making sex hormones or we're making stress hormones. And if the body is in a chronically stressed out state, one of the symptoms we can see is a lower libido. But today on the show, I'm going to talk about kind of what to look for if you're like, wow, my sex drive is just completely non-existent. I don't even think about it anymore. And when I talk about drive, I'm not talking about how much you're having sex. It's how much your desire for it is. If you never think about it, that means you've got a pretty low sex drive. So there are some physical things that can contribute to this. There are also some mental things that can contribute to this, which we'll talk about too. But if this is something you're struggling with, these are some of the things you want to look into. So the first thing, which is probably the most obvious thing, is going to be your sex hormones. And so we'll talk about women first, and then we'll talk about men. For women, there are several different sex hormones that are going to, contribute to this. So we want to make sure you're getting your estrogen, your progesterone, and your testosterone levels checked. If you are a cycling female that is not taking birth control, so we'll talk about birth control in a minute, the best time to have these hormones checked is around day 21 of your cycle. Oftentimes what I see is patients are like, oh yeah, I did have my hormones checked, but they didn't take into consideration what point of their cycle they were in. And guess what? These hormones change throughout the month, which you probably already know or realize. If you check them when you're on your period or in that first week, they're all going to be low because that's naturally when they're low to begin with. So the best time to check them is on a 28-day cycle is around day 21. That's the point in which your progesterone should be at its highest and your estrogen is fairly high, but we want to make sure, there's a couple things we want to make sure here. One, we want to make sure you have adequate progesterone. And one of the reasons why progesterone is so important for libido or sex drive is that progesterone chills you out. It is like the calm hormone. And when women have lower levels of progesterone, they tend to have higher levels of anxiety. And if you've ever experienced anxiety is a complete libido killer because when you're anxious, you're going to be thinking about all the things you're worried about, your to-do list, all the things you got going on next week, the things you said to someone last week or someone said to you. You're not going to be really in the moment. And it's really important to, if you want to be physically turned on, to be in the moment. So really important to have enough progesterone. We also want to make sure that estrogen is not either too low or too high. Too much estrogen tends to trigger symptoms in women. It can cause acne. It can cause really heavy cramping or bleeding during periods. It can sometimes contribute to weight gain. It can cause mood swings like depression. And, sometimes these physical symptoms make you not feel very good about yourself. And if you're a woman and you're listening to this, when we don't feel good about ourselves, it's very hard for us to have an interest in sex. So making sure estrogen levels aren't too high is important more for the other symptoms that high estrogen will cause and how that makes you feel about your body. So we want to make sure that estrogen levels are not too high. We also, like I said, want to make sure that they're not too low. Low levels of estrogen can also cause mood disturbances like anxiety or depression, and it can cause vaginal dryness, can cause, one of the main symptoms is low libido. So we want to make sure that those estrogen levels are in an appropriate place. So again, checking around day 21 is the time at which we can determine, it's the best time for us to look at what those levels are and how they're relating to each other. The last hormone we want to look at is testosterone. And testosterone, most of us kind of know it's involved with sex drive. If levels are too low, and oftentimes I see this in women, they'll have just no interest in sex. Low testosterone can make it harder for women to lose weight. It can make it harder for us to gain muscle mass. So kind of what I was talking about with estrogen. If we have some of these symptoms that low testosterone causes, it makes us not feel as good about ourselves. So looking at testosterone, really, really important. Okay, so those are like the sex hormones that you want to look into. Next thing we want to look at, and I'm usually looking at these simultaneously, is we want to look at your stress hormones, which are your adrenal hormones. And you guys know I talk about these guys a lot. cortisol being the big one. So you want to have your cortisol levels checked in the morning, and you want to look at what those levels are. Typically, you want to go before 10 a.m., and a good morning cortisol is going to be around 15. Most of the women coming into my office that are struggling with low sex drive, their cortisol levels are like between 6 and 10, which are a little bit lower than we'd like to see. When cortisol levels are lower, your energy is going to be lower, your mood tends to be lower, your motivation tends to be lower. So partially low cortisol can contribute to that not feeling great about yourself. Your energy is low. You're not going to get as many things done. You may have more anxiety because of the fact that you're not getting more things done. And so that can kind of play into the libido thing. But the other thing that can happen is typically if your cortisol levels are low, probably at some point prior to when you were getting this checked, they may have been really high at some point. And when cortisol levels are really, really high, that means your system was stuck in a fight-flight state, which means it probably wasn't making enough sex hormones. If you stay in this situation for a long time, we'll first see cortisol levels start to decline. If external stress or internal stress stays at a high level, the body will then start to steal from your sex hormones. In women, it usually steals from progesterone first. So it'll kind of steal from the progesterone bank account and will shunt it over to cortisol so that you can keep enough cortisol up so you can get through your day and have energy. But then we don't have as many sex hormones. It can also start to steal from your testosterone. So as you can see, when cortisol is a little bit dysregulated, it can directly affect our sex hormones. Now, this is also going to be true for men. Let me go back and we'll talk about what we want to look for if men are struggling with low libido. For them, we want to look at their estrogen and at their testosterone. Testosterone is obviously the most important one, but sometimes if men are making too much estrogen, or if they're not breaking down enough estrogen and their estrogen levels are in a higher range, that can kill their sex drive. And that's because it can affect mood. It can actually lower the ability to, maintain an erection. And testosterone for men is like the number one thing. So if testosterone levels, the reference range is up to about 900 for, if you're in your 20s, we want that to be, between 800 and 900. 30s, it can go down a little bit, but you don't want it to go less than 600-700. So if it's in the 200s or the 300s, you're going to see lower libido. Now, there are different options for, increasing that, which we'll talk about at the end, but those are the two main hormones we like to check in men. So the estrogen, the testosterone, and then looking at their cortisol as well. And sometimes in men, what I'll see is they come in and when they're in an acute stress state, their cortisol levels will be really high and their testosterone levels will be low. And what's happening there is oftentimes the body, again, it will steal from the testosterone to keep the cortisol levels in a good place so they can deal with all the stress. But while they're doing that, their libido or sex drive is probably going to suffer. So sex hormones and adrenal hormones are, the first place we want to look for both men and women. Really, really important to kind of know what's going on there. The next thing we want to address, or we want to look at when we're kind of trying to figure out, okay, why is someone struggling with a libido, is their thyroid hormone. Thyroid is going to it controls your energy, it controls your weight, it controls your bowel movements, your hair, skin, and nails. It's another major master hormone regulator. The biggest way that, let's say that your thyroid is low, in a low thyroid situation, we tend to see low mood. We tend to see mild depression. We can see some anxiety, but the mood piece is going to directly impact, how you feel about yourself, how you feel about your body, and that can have a big impact on sex drive, particularly for women, because a lot of women, when their thyroid is low, they have trouble losing weight. They may have hair falling out. They don't feel good. And when you don't feel good, it's really hard to get in the mood, right? So looking and making sure that your thyroid is functioning optimal is really, really important, again, for both men and women. The tests that I recommend running when we're looking at thyroid are going to be your TSH, which stands for thyroid stimulating hormone, your free T3, your free T4, reverse T3, what we call thyroid antibodies. And then we also want to look at something called T3 uptake. And if you get all of those run, you're going to get a really complete look at your thyroid. I have a lot of patients that will come to me and they are presenting very much like a textbook hypothyroid patient. They're cold all the time, they're fatigued, they've gained weight, their joints hurt, they're constipated, their hair's falling out. But they've been told by their doctor, oh, hey, your TSH, your thyroid stimulating hormone, is totally normal. It's 3.2, which is well within the reference range. But they don't look at any of the other numbers. So you can have a perfectly normal TSH. The 3.2 I mentioned is actually not perfectly normal. We want TSH to be around a 1. But you can have a perfectly normal TSH, but if you don't have enough of the active thyroid hormone, the T3 or T4, you're going to have a lot of hypothyroid symptoms. And so that's one piece. The other piece is if your cells are not taking up that hormone as they should be, so this is why I like to measure the T3 uptake. If your body's not uptaking that thyroid hormone, you can have all your other numbers be okay, but your cells are not actually getting that thyroid hormone, so you're going to have some of the hypothyroid symptoms. So really, really important. And again, if you guys follow me, I talk about this a lot. Really important to have all of these numbers checked so you can really understand what is exactly happening with my thyroid. So thyroid is the next piece. And then the other thing that I like to check in my patients when we are, kind of trying to figure out, okay, what is this low libido or what's causing it, is looking at what I like to call internal stressors. And internal stressors are things that are causing the body stress from the inside versus an external stressor, which would be something like your job or traffic or the pandemic or the election, things that are kind of out of our control. But when we have something going on inside our bodies, the biggest thing I like to look at are what we call stealth infections. So something like Lyme disease or a chronic Epstein-Barr virus or long haul COVID or things that are creating a stressful environment inside the body. And the way that this affects libido is your system's going to be super, super stressed out if you have Lyme or if you've got a chronic EBV situation or if you've got long haul COVID, because the body's spending all of its resources trying to fight this infection. And when that happens, we tend to see, again, either really high levels of cortisol when that fight starts, or we can see lower levels of cortisol, and that will take a toll on the sex hormones. It's really common for me to see a patient where they come in and they've had their hormones checked and their estrogen is in the tank, their progesterone's in the tank, their testosterone's low, and their cortisol is low. And they'll tell me that they're not stressed out. And I'm like, well, that's interesting. And they're like, yeah, my got a great job. My kids are great. I've got a great partner. I'm doing well financially. And they're like, I don't really have much stress. But they're presenting, but they're like, I have zero sex drive. And they're like, that's the only stress in my life is that I never want to have sex and my husband's pissed off. And this is a common thing that I see. But we'll run a screen on them and we'll find, hey, they have this underlying stealth infection, whether it's Lyme or EBV or some of these other infections that we check for. And once we start to treat that and we take away that internal stressor, the cortisol levels can get rebalanced, which can then help the hormones get rebalanced. And then, libido tends to come back. So really, really important to make sure that we're doing a deeper dive and checking for some of these other things, particularly if you're like, okay, there's not much in my life that's causing me a lot of stress. My life seems to be really good, but I can't seem to figure out why, my libido just isn't there or it isn't what it used to be. So looking for kind of, again, these internal stressors are really, really important. So again, sex hormones, adrenal hormones, thyroid, and then looking at these internal stressors. One of the other things that can be an internal stressor are nutrient deficiencies or nutrient depletion. So it's also really important to look at B12, iron, vitamin D, zinc, magnesium, kind of all of these nutrients that are really, really important as cofactors for building hormones or for breaking hormones down. If you don't have enough of those, it can be very hard to keep your sex hormones in a good, healthy place. So this is a really common thing I see in postpartum women, and this could be anywhere from 6 weeks postpartum to 2 years postpartum. And they're like, yeah, I feel pretty good, but my sex drive is just in the tank since I had baby. Now, there are other reasons why your sex drive could go in the tank when you have a baby because you have an infant and you're not getting much sleep. But let's say you're 2 years out and your baby's sleeping through the night and you're like, well, most of the things have come back, but my sex drive just isn't really there. Looking at these nutrient levels can be really, really important, particularly if you've had multiple babies in a span of a short period of time or if you've nursed for a long period of time. We tend to see lower levels of nutrients in those patients. And again, B12, iron, vitamin D, zinc, magnesium, those are the big ones that I look at because those are some of the big cofactors that the body uses. We can also check for some of the other B vitamins, B5, B6, B1, B2, folate, and the omega-3s are a really, really important thing to check as well. So looking at your levels of good, healthy fats, because those can also contribute to the building of hormones. So there's a lot of things to look into. And I think it's a really common issue that I see. I have so many patients that come in and they're like, they have other issues going on. They're like, yeah, my sex drive just isn't what it used to be. And again, sometimes that will take a toll on a relationship. So, if you're listening to this and you're like, wow, this is something that I struggle with. And it's funny, last week I ran into an old friend and she's like,
Erin, we got to talk. She's like, your social media, you talk a lot about how with sex, you got to use it or lose it. And she's like, my husband keeps walking around the house being like, you better use it or you're going to lose it. And she's like, and I feel bad. I know we should be having sex, but my sex drive is just completely gone. And so for her, she's going to have a hard time going and like making herself have sex because she doesn't feel like it. So if you're like, wow, I have zero sex drive, it's probably time to go to the doctor and have some of these things checked. So if your doctor's not willing to order these tests for you or to dive a little deeper, like I always talk about, find someone that will, because it's a really important part of life. It is a good sign to me when my patients, it's one of the major things I ask. I'm like, hey, how's your energy? How's your sleep? How's your sex drive? And when someone has a really healthy sex drive, it's a very good indicator that their system is really healthy, that their adrenals are in a good place, their sex hormones are in a good place. So if your sex drive is low, your body something's not right. So thank you guys for listening. Hope this was helpful. If you have questions, you can, message us on Instagram or reach out to the clinic. Or if you want to chat with one of us about doing some of this testing, you can schedule a free consult and we'll be happy to talk you through it. Hope everyone has a great week. See you next time.
Thank you for tuning in today. If you enjoyed this conversation, be sure to connect with me on social media to find more helpful tips and information. You can find me at Dr. Kinney on all of the platforms. And please be sure to subscribe and leave a rating and/or a review. This helps grow the show so more people have access to this knowledge that leads to empowered healing. Love and light, and see you next week.